everybody. I'm Dr. Akhil Dadi, orthopedic surgeon and robotic knee replacement surgeon from Srikara group of hospitals. Till today, we have been doing knee replacement in a conventional method, and for a long time we used computer navigation to do knee replacements. All of us know that in a knee replacement, we change the worn out surface with a new metal implant, as well as on the lower part we have a metal implant and a washer inserted. But our major problem, especially in India, is that the knees which come with a lot of deformity because of the degeneration, because it is worn out in such a way that there is a lot of deformity, either valgus or in varus. Now, the basic aim of a knee replacement is to give 100% or a near 100% correct straight alignment of the limb, of the entire limb. We should give back in a knee replacement nearly 100% of the alignment correctly, with perfection, with accuracy. All this while, whoever of us are doing it with a conventional method, by and large with some measurements, know that we have come very close or very near to achieving this alignment. But we have not given 100% precise, accurate correction for that particular limb, for that particular individual. The only way this 100% of correct alignment, correct straight limb, as well as correct kinematics, it is called, that means how much will the knee fold when you do surgery and what rotations the implant has to be placed, is told by robotics in accuracy. So this robotic which does the surgery along with us is a co-surgeon or an assistant surgeon. It is not completely doing the surgery. We are doing the surgery as surgeons, but it is an assistant surgeon, it is a co-surgeon. So what the robotics does is, just like navigation, suppose if this X-ray is of somebody whose knee is badly worn out, and with whatever parameters we have measured that this is about 30 degrees deformity, and we have to make it to 0 degrees of deformity. A straight line has to be given. So from here onwards, the robotics, what it does is, this 30 degrees, it also measures during the surgery. It measures this 30 degree of varus, how much is the knee folding before surgery, what are the other deformities, there are so many other deformities, what are the rotational problems. The robotic first, along with in it, because it has a computer inside, it does this deformity assessment, and then, unlike navigation, which is passive, which just stands there and aids in and just measures what we have corrected, just measures. Navigation only measures what we are operating, whereas the robotic from here onwards takes on, it has got in its arm the drill, it has got these trackers which so with all its machinery, it is a robo. Like robotics are used for manufacturing things correctly, like robotics are used in delivering things correctly. From here onwards, the robotics takes the responsibility along with the surgeon to do all corrections to get this to 0 degree. That is when it delivers what it promises. 0 degrees complete correction, or does the surgeon want 5 degrees, it gives you. So what is to be delivered is entered into the robo, and then the robo takes on the surgery from them. We have been doing this robotic surgery from the past 3 years, so we have crossed our 3rd anniversary, and we were one of the first in India itself to buy this machine, one of the first 5 or 6 machines in the world. We were the first to get them placed in Srikara, and we are happy, we are utmost happy with the results what we are giving to patients. There is a certain sect of people called valgus knees. It gets worn out the other way very badly, which is seen only in rheumatoid arthritis patients. Now with the conventional technique, these valgus knees, whatever you do, you cannot correct them completely. But with robotics, we have found that robotics does the surgery in such a way that it takes away bone wherever is required, it does not touch ligaments and muscles unnecessarily, as well as it corrects it to 0 degrees. If we have fed inside it that I want a complete 100% alignment wise correct, precision wise correct surgery, only the robotics can do. So in other words, robotics is a co-assistant, is a co-surgeon in whom we feed what we want to achieve with the patient, which is near 100% precision or accuracy of alignment, of rotation, of placement of the new metal implants inside. Robotic does that job, and because of this, because of doing it with robotics where you are getting 100% precision and accuracy as well as very good folding and kinematics of the knee, we are sure all over the world now, we are sure that the longevity of the implant will be very high. Probably it will last beyond 30 years. It might last you a lifelong 30-40 years. So robotics is the best way to do a knee replacement and guarantee a complete 100% precise, accurate surgery of giving back alignment and kinematics to the patient. Thank you very much.